That could definitely happen.
This is one of your books, Lillian's book you wrote, Treating Stress and Anxiety. Can you tell us some words about your book here, please?
Yeah, well, that book was written quite a while ago, but it really is for clinicians. So it was directed at clinicians to help them help their clients with stress and anxiety. So, however, within that book are all of the handouts for their clients as well. So it contains a lot of things that are relevant to the anyone who's like has issues with stress and anxiety, but it's actually a book for practitioners.
For practitioners. Okay. Thank you very much for giving us, input on it.
No worries.
And this is, I think, one of the most important topics. People work a lot. I don't know how many people in Frankfurt I know, or also in the States, in Chicago, everywhere, not only here in Europe, in the States, everywhere, people I interact with, okay, in these two continents. And
Yeah.
most of people I know have problems exactly of really either falling asleep or sleep through the night.
Yeah.
Like everyone I know.
Yeah.
Almost
It's
everyone.
really common. It's really
Very common.
Yeah.
So is it something, a new phenomenon, or has it always been there?
But that's a really good question. I mean, they say the statistics are around 10% of people have insomnia. That's a lot of people still, 10%.
A lot.
So I don't know if that's changed much. Certainly more people are willing to talk about it. Maybe that's the difference.
Yes.
However, I will say that it makes sense for it to have increased if anxiety has increased. And anxiety has increased. And certainly the more anxious we are, the less likely we're going to be able to sleep, because anxiety is like the opposite state of relaxation. So you need to have a relaxed kind of body and mind to really sleep well. So part of treating insomnia is really treating stress and anxiety. So, and depression often too.
I think it's a much better way of treating it than trying to just get some medications to fall asleep, right? That's what some people do, which is, I don't know, it's like a vicious circle, right?
Yeah, well, it's not solving the problem.
Exactly.
Right. So it depends on what you think the problem is. But what I mean by that is, okay, you might be sleeping that night. So to you, it's solving that problem, but it's not solving the actual problem that's leading to the insomnia.
Yeah.
Which means that you'll always be dependent on the medication to sleep. So if you don't want to be, and really sleep medication isn't the first line treatment for insomnia.
It's not. Okay.
And it's meant to be taken for short term. Sleep medication was kind of initially really made to help with short term issues. So like jet lag, or you're undergoing an extremely stressful situation. And so the longest amount of time you're meant to be taking it is 2 weeks. But people are taking it for years.
Yes, yes.
And there are so many other things to try before medication is the kind of go-to strategy. Um, and that includes what we've already talked about, like relaxation techniques, general sleep hygiene, um, the way that there are certain techniques relate that are in cognitive behavioral therapy for insomnia that can be really helpful, like light therapy and sleep restriction therapy. And also, like I was saying before, I don't know if this is a question you've asked um, the colleagues that you know who have trouble with sleep, but if you ask them what's getting in the way, is it their thoughts? Because if it's their thoughts getting in the way,
Yes.
then you need to deal with that.
Yes. That's it.
And if you know the strategies to manage that, then maybe you'll find your way to sleep without medication having to be, part of the routine. So yeah, there's a lot. And, there are, again, it's one of those areas that because it's something people are talking about, there's a lot of people selling a lot of things online
Yeah.
um, to help with sleep and that aren't particularly based on rigorous studies or, that really have that much efficacy, but they're just marketed well. So I think be very mindful of that.
Yes, absolutely.
Mm.
And now we go to another one. This was Life Blockers Sleep Edition.
Mhm.
Can you tell us about this book, your book?
Yeah, well, what I thought was I was going to write a series of books that had these kind of like accessible, practical, quality strategies in them and with different topics. And I started with insomnia.
Mhm.
That's why and the reason why I called it life blockers is because I had kind of coined that term to mean just the things that are the obstacles to you having the life that you want.
Absolutely. Yes,
And sleep is one of those things.
it
If you
is.
don't get enough sleep, well, it impacts pretty much every area of your life. So I started with that. The idea was to have a series, but then I actually veered off from books to the online program. So instead of a series of books, I had a series of programs like the anxiety one, the stress one, the sleep one, the mindfulness one. I might go back to books. I actually do like to write. I wouldn't say it's my relaxation activity, but I do like it as part of my work. Um, so I may go back to it, but yeah, that's what it's about. So it's just a little booklet. It's not long. It's just with practical strategies and skills to help with sleep. And it's
Mhm.
basically almost exactly the same as the insomnia program. The insomnia program, it's an audio program. So if people prefer to listen, they can listen. If they prefer to read, they can grab the book.
Oh,
The
there's
audio
an
program has a
audio.
lot.
Excuse
Sorry?
me. It's an audio version of this book as well available,
I
you said.
do. Yeah, I do have. So I've got the book, I've got the audio book, and
Yes.
then I also have the audio insomnia, overcoming insomnia program that has a couple of extra chapters in it and has like experiential activities and things in it as well. That's available. So yeah, so I mean, part of me making things accessible is to make them accessible in different ways so that they suit the preferences of the learner. So some people prefer to read, some people prefer to listen, some people
Yes.
prefer to write, some people prefer to see.
Yes.
So I have all of those elements in the programs and the resources and the content that I provide.
Lillian, I'm just asking this question because mostly there are two versions of audiobooks. Do you read your books yourself, or is it your voice or someone? Okay, that's the
It
best
is,
thing.
it
That's
is.
really the best thing. I think, a friend of mine, because he's doing an audiobook, and he said he doesn't like to read because he doesn't want to do it himself. And I just told him, don't do that because some people have someone else, like a professional who reads that book. And I said,
Mhm.
readers don't like that. They want to listen to your voice because you
Mm.
wrote this book. I think you agree with me on this point, right? If you make an audiobook, right? Yeah.
Yeah, look, I think for the most part, I mean, unless you have like a terrible voice, maybe some, but I mean, that's a mean thing to say, but like some voices are easier to listen to than others. But I agree, like you've written the book. Like, why
Yeah.
not be the voice of the book? It is your book. It is a bit weird to have somebody else read your content. I think that's my experience even with like novels. I mean, I don't really listen to novels, I usually read them, but if I was listening to one, I'd prefer it to be the person who wrote it
Yes.
rather than somebody else.
Yes. Especially in novels, you see that trend that someone else reads the novel and makes an audio. That's
Mhm.
you see not everyone, but you see that. That's the reason I.
Most people do, yeah.
Yeah,
Yeah.
Okay, we go to just again in explain this. You already did mindfulness. I think is also important. I think I love this concept of mindfulness. You explain in your research also online. Could you just tell us some words about mindfulness, please?
Yeah, I mean, mindfulness is essentially paying attention on purpose in a non-judgmental way
Mm.
to your experiences, and accepting your experiences in a non-judgmental way. So this course is just a 30-minute introduction to understand what mindfulness is, why it's helpful, to dispel some of the myths about it, and then start with really simple exercises based on your senses. I think it's really important to make mindfulness less esoteric and more practical. And so people can weave it into their lives at any time. I don't think that you need to be sitting in the lotus position for 20 minutes in a dark room uninterrupted to get the value out of mindfulness. I think you meet a lot of people who do that. That's fine. Like that works for them. But for a lot of people, that's not going to work. So having like other ways of including mindfulness in your life that take a couple of minutes or 5 minutes or and you don't have to stop and be in a space with no people. You can, do it anywhere with anyone around. You can be doing an activity and be mindful. So there's lots of different ways to be mindful. And so this 30-minute um, program is really just introducing that side of it, that side of mindfulness. That's super practical, super user friendly, and that will help with a whole range of things. It helps with calm, with focus, with decision making, emotion regulation, a whole range of things. So yeah, so it's an important core skill, I think, for mental health and well-being.
Yes. So you have also some tips here, again, all taken from your website. And I
Hmm.
really urge viewers to go to your website but we will come back to it later. Coping with anxiety and stress. You explained it that lots of thoughts, like worry lead to anxiety and stress. And as you explained, to depression as well.
Yeah, that's a video program, and it's really just about introducing various strategies, again, really practical strategies that people can use to reduce stress quickly. And then you get to create your list out of that.
The list of factors which make me feel like anxious and stressed. That's what you
No,
mean?
the list of strategies that will help you.
Oh, the list of strategies which will help me. Other way around. Okay.
Yeah,
Of course. Of course.
like
Yeah.
your calm kit. I call it a calm kit.
Beautiful. Really nice. This is this relaxation techniques. Could you just tell us
Yeah.
some words on this one, please?
Yeah, so I've recorded a number of relaxation and mindfulness techniques over the years. This CD was developed in 2008, which is why it's a CD. Um, but if people actually want to listen to the techniques that I've recorded, a lot of them are on Spotify.
Spotify.
And so progressive muscle relaxation is probably the most evidence-based one in terms of reducing stress and anxiety. So maybe start with that if you haven't tried that before. But there's also a number of visualization exercises and mindfulness exercises. And I've just recorded 3 more albums, so they're going to be coming out soon.
Wow.
And
On
they're
Spotify?
they will come out on Spotify. Some of them are located on Insight Timer, and some of them will be located on Contain Your Brain eventually as
Oh,
well.
continue.
Um, and they're focused on stress, sleep, and anger and frustration.
Wow. Very interesting.
Yeah, I'm editing those now.
Oh, very nice, very
Yeah.
nice. And tell us something about Audible, what you have there.
So Audible's really where you put the audiobook recordings.
Mhm.
And it looks like they've included my relaxation techniques CD recordings on Audible as well. So it's probably just another place you can find it.
Very nice. Okay, now we go to something which is extremely, extremely important. And I think these are these courses you provide and coaching and also for professionals. I'm sure
Mhm.
many people are connected with me because I'm going to also put this link on LinkedIn. Many lawyers, many professionals in financial industry, also university professors would be interested in that. Could you just give us some information on these courses and coachings you provide, please?
Yeah, absolutely. I really like working with organizations who value mental health and want to support their employees' mental health. We know from research that when you are feeling well, you are more productive.
Yes.
And but I really want to work with people who want to do it more, for because they care about people, not just because they're gonna be more productive. And the way that I help organizations is really at the place that they're ready. Like so if they would like their employees to have access, for instance, to some of the programs that I have on insomnia and anxiety and stress, then I can share those resources with their employees. Often that's really helpful to do alongside like a set or a series of webinars. I've often conducted webinars that are, again, very much about practical strategies to assist with stress and anxiety, sleep, um, have, having healthier behaviors, um, managing and preventing burnout is another one. And also managing your mind and dealing with worries as well is another one. And also even just informational ones. I recently did one about anxiety disorders because I think it can be really helpful for people to even understand what's the difference between normal anxiety or functional anxiety, dysfunctional anxiety, and then disordered anxiety, and how you might detect that, and then what you would do about it. And I think more and more managers are being asked to be mindful of their employees' mental health,
Absolutely.
and they really need to know what the signs are, but also what happens then, like
Yeah.
what do we do about those signs?
Yeah.
Who should I be getting help from? Where should I be getting help from? What's my responsibility versus their responsibility? All of those questions, because it's a hard task for managers to have to take on board now, because that's not their wheelhouse. It's not what they studied to
No,
do.
no.
So it's really important for them to get support. So I've also, one of the services that I've done in the past is provide support to managers in terms of helping them work through mental health issues that come up in their teams. And that's often with one of their people and culture professionals in attendance as well. So we can both facilitate and help the leaders in the organization work through um, what's going on in their team and how they can actually help their team members. And that lifts the stress off of them as well. They've got
Yeah.
consultants to work with.
Absolutely. And as you mentioned, mental health, and we realize it is should be done by a professional psychologist. This is not the field that you learn in business administration or in law or
Right,
in
exactly.
engineering.
Yeah, it's not
Absolutely.
fair to expect that. I mean,
Yeah.
you need to be able to um, have awareness.
Yeah.
You need to be able to um, promote healthy behaviors, and you need to be able to know how to respond if you see mental health problems pop up among your team, but you're not responsible for treating the person,
Of
right?
course.
Um,
Yes.
and yeah, I think it's hard to know where the line is sometimes. And so, and at this point of transition where psychological safety is becoming part of the legislation in organizations, it is in Australia now. Um, I think people just don't know where the line is. And so it's going to take some time to work out what's my responsibility, what's the organization's responsibility, what's the person's
Also, you have a
responsibility.
legislation now in Australia. Did I understand you correctly?
We
Oh,
do, yes. So psychological safety is mandated. And so they have to protect the psychological safety of their workers. They have to promote healthy behaviors and they have to respond appropriately to mental health issues.
wow. Okay. So
Yeah.
it's already in legislation. Very interesting.
Mhm. Yeah. And those are the real keys, like protect, promote, respond. Yeah.
And to understand if this anxiety is a disorder is also very difficult, right? Because then disorder will affect the job performance heavily, if I'm correct.
Well, I mean, the great thing though, if you're aware and if the stigma is low in your organization, you can actually get on top of anxiety earlier and it won't necessarily significantly affect anything, right? So if you're going in and focusing on prevention and early intervention, then you might not have to go to full blown treatment. Um, Even then, anxiety disorders are extremely treatable. Most of them take, between 8 and 12 sessions. If you have a full-blown anxiety disorder, 8 to 12 sessions. Some of the more complicated versions might be maybe 20, but that's if someone's had like generalized anxiety disorder, for instance, for 20 years, then it might take longer. But if someone develops panic attacks, that can be resolved pretty quickly. So I think it's really just a matter of really understanding that. And I think that's why I presented the All About Anxiety Disorders webinar, because I think it's really important for people to understand what the signs are and the symptoms, but also what's the science behind it and what are the supports available and be, to kind of destigmatize and demystify it because anxiety is a really treatable issue.
So if companies want to contact you, they can contact you, corporations, companies also on your website, correct, for these programs.
Yeah, they certainly can on my website. And if a lot of people are on LinkedIn these days too, if you can contact me via LinkedIn as well. But I do have a contact page on my website.
Okay, on LinkedIn.
Mhm.
So this is exactly, I put it on purpose here for all lawyers and law firms I work with. And it caught my eye. The legal profession is notoriously demanding. And it's true. Lots of pressure
Yeah.
these lawyers go through. Yeah, that's right. Which is also part of it.
Yes. Yeah, I was approached by the Law Institute of Victoria in Australia to write about um, the emerging health tech for mental health, um, and how to select apps safely. Because, like I said before, there's a proliferation of well-being products out there, and they're not all the same quality. And people are making decisions based on the number of followers, often,
Yes.
um, and downloads, and even ratings, when those are not the factors that make an app safe
Yeah.
or good quality. And so the article I wrote was really just outlining, you know, what to look for. And one of the main things is really around privacy. I think what most people don't know is that most mental health apps are collecting your data. Um, and they need to have very good, strong policies around that. You need to know what they are and what they're doing with your data. We've decided with Contain Your Brain that we don't collect any data at all, so that people don't have to worry about privacy at all, because we don't want them to worry about anything else.
Mm.
Um, so we've given them one less thing to worry about. But that's really, really uncommon. There's not very many apps that don't collect any data.
Yes, absolutely. Very good point. You raised a
Mm.
very, very important point. What happens to my data, right? You're right.
Mhm.
Absolutely. Very important. Okay, I put also this one because on this channel, there are not only academics, lawyers, and so, but many athletes as well. And they all worry about their mental strengths, not only the muscle or stamina. And
Mhm.
it's regarding tennis, but okay, doesn't matter. Competitive sport is competitive sport. You need to have a
Yeah.
special mindset. Can you just give us some words on this, please?
Well, I am like obsessed with tennis,
Yes.
especially the Australian Open. So it really, I've been going every year for 30 years. I've really been watching. I love sports in general too. So it was really interesting to me to take some of the strategies that are I can see that are used to assist athletes, because they're performing at such an elite level that really it's your mindset that sets you apart from the other athletes.
Yes.
And you can see it. It's very clear on a tennis court because it's one person against another person rather than like teams with helmets and
Yes.
things like that.
Yes.
But you can see the ones who really back themselves, who who use acceptance very well. Like, when you make a mistake, instead of dwelling on the mistake, which distracts you from focusing on the task, if you accept it in the moment, I've made a mistake, and then let it go, you're going to be in a much better place. Um, Being able to regulate your emotions, like easily and quickly, is really important when you're, a tennis player or any athlete. Maintaining healthy habits, which we talked about before, is like what they do really well. Staying in the present, so having those kind of skills to be really mindful and focused in a flow state. A lot of athletes are practicing mindfulness these days. Um, and also having like your list, like we talked about before, everyone's list for stress management or for facing pressure situations is going to be different. So know what yours are, like practice a number of skills that help you in those situations so that you know what you can do when you're facing one. I think can be really important. And also, I guess, having a really, really good support system. Like you don't get to the top of your field, or you're not as a top athlete if you don't have people around you who are supporting you and helping you. Tennis players have a whole team around them assisting them usually, like if they're really doing well. So yeah, I think the other thing that they do is visualization activities, going through the motions of success, what success is to you in your mind, can be a really powerful and effective tool to prepare people for whatever that might be, whether it's a match or, a presentation or anything. Um, so I have visualization practices on Spotify for people if they want to try those as practices. And I guess the last thing is like, are you doing something you want to do?
I, well,
Like uh, if you are dreading what you're doing, then what is it worth it for you to continue to do it? I think sometimes that's a hard question for people to ask of themselves, but I think that um, if you don't have meaning and purpose in what you're doing, it's going to be hard to be successful. You can see it like on the tennis court, and you can see it in the workplace, and you can see it in schools. Um,
because sometimes people are forced deliberately or unconsciously, whatever, to do something, maybe by parents, maybe by
yeah,
environment, right? Is it what you're saying? Mhm.
yeah, absolutely. You have to understand what your values are
Mhm.
and um, reflect reflect on whether what you're doing is in line with that. Sometimes it has been for a while and maybe you've changed, and that's okay too. Um, but sometimes it's just not. You're doing things for other people for other reasons that aren't about you at all. So it's helpful to be aware of that.
And this was this stress management app. Like you mentioned that already. So if I have stress, I can use this app as part of Contain Your Brain. Can you just give us some more information? Because I think it is really fascinating. I really love this expression, contain your brain. It's really nice.
You. Yeah, look, essentially it's an app that helps you worry less and worry better. And that's what helps you relieve stress and anxiety and helps you sleep. So it's worry time plus helping you address your problems effectively. So it helps you set up your worry time. It gives you notifications for when that is, if you would like that. And then in your worry time, you categorize your worry, and then you get strategies that match the worry. And that's essentially it. And it's very private. It's securely stored on your phone only. And people can feel safe. And the strategies are really simple and effective. And it's free now.
Oh, it's free.
It's
Wow.
free. You can download it for free.
That's fascinating. I didn't expect this one. Okay.
Yeah. Yeah.
Wow. Okay. It is free.
Yeah.
Just may I ask this question? Why is it free? Because you want to help people? Is it the reason?
Well, essentially, yeah, we wanted to make it as accessible as possible. We did have it as a paid app, as a one-off payment, which we
Yes.
thought was because people who put apps out do a subscription. I didn't
Yes.
feel comfortable locking somebody into a subscription, but so I thought, well, we'll just do a one-off payment, like $5.
Mm,
That's forever, and you have it forever.
mm.
But even $5 is a barrier for people. I think in
It
app
is.
world, most people expect a free app, and it seems like a lot for an app, even though logically it isn't.
It
And I
isn't.
just, I just wanted this to be in people's hands and for there not to be any barriers. So we've recently made it free. So it's been out for a month,
Mm.
and making it free has definitely made a difference.
Oh,
It's
yeah.
doubled the users already, and more than doubled actually. And hopefully will continue, because I really think that we're spending a lot of time in our heads, and it would be much better utilized um, if we're focused on something else, something more enjoyable, or
Mm,
even getting to sleep better. That's a much better use of our time than thinking about things that don't really matter.
mm. Absolutely.
Mm.
Absolutely. Okay. Thank you very much for all your explanations. Very, very useful and very helpful. Really fascinating. Each time
Mm.
I talk to you, you have added and done more. I only wish sometimes we were in the same field because I have published with many scholars together and different
Mhm.
articles that we could have published something together. But our fields are very
You can start
different.
me off since you like writing so much. You start it, I'll finish it.
Really would be great,
Sounds
you
good.
know. Would you
Yeah.
like at the end of our discussion to add anything and to tell our subscribers and say anything, any word to them, please, Lillian?
Well, I guess what I'd like to say is thank you for having me. I really
No,
appreciate you and for you
honored.
inviting me a second time. I want to let people know that, if you're feeling stressed or anxious or you're having trouble sleeping, that these are really treatable issues. And if you don't want to see a psychologist, and maybe you don't need to, you're not maybe at a stage where you need to, there are lots of other options and resources at your fingertips. So that might be for some people an app, for some people it might be an online program, for some people it might be an article that's really helpful, or an audiobook. Whatever it is for you, go and access it, because the earlier you get help, the earlier you'll feel better. And if
Thank
you
you
want to
very
contact
much.
me, yeah, you can
Excuse me.
contact me on drlilliannejad.com. And if you want to know more about Contain Your Brain, you can go to containyourbrain.com and you can download it straight from your app store.
I'm going to put Lillian's, Dr. Nejad's information on website, also LinkedIn, and all ways that you can contact Lillian and Dr. Nejad for anything you wish to have. Again, many, many thanks, Lillian, for being on our channel. And
Thank
I
you.
wish you, thank you, and I wish you a nice day.
Thank you so much.